There you go.
Doctor,
can you hear me?
Yeah, Dr. Aimee, I found you. Thank you. So if you want to go ahead and take it, really appreciate you being here, and very much thankful that you're going to be come in and talk to us and maybe have some opportunity to take some questions. Really appreciate it.
Yeah, thank you. Thank you for the opportunity. Happy to be here. And I'm home with my dog, so Lucy may be participating intermittently, but hopefully not too much. I have a few prepared comments, and then I want to leave plenty of time for questions. But I wanted to start by saying a little bit about the current disease activity in Placer County in terms of cases and hospitalizations and being on the state monitoring list and the implications of that, and then a little bit about precautions we can all take moving forward to try to reduce the spread of coronavirus. So starting with our numbers here in Placer County, hopefully all of you are following these numbers on our dashboard at placer.ca.gov/coronavirus. And if you click on data, it sends you to a dashboard. Happy to say that we just updated the dashboard today with some new features. So we're now reporting some additional hospitalization details, including county of residence and because of COVID. We also have the case rate per 100,000 over the last 14 days on the dashboard, as well as the testing positivity rate. So some nice additions today. After that plug for the dashboard, the actual numbers. So in Placer County, there are 1,203 laboratory confirmed cases of coronavirus that, as of today, we added 36 cases from yesterday. That puts our case rate per 100,000 over the last 14 days at 112.7. In terms of our testing positivity rate, that is at 6%. And then hospitalizations-wise, in our 3 Placer County hospitals, so that's Sutter Auburn Faith, Sutter Roseville, and Kaiser Roseville, we have a total of 50 laboratory confirmed cases hospitalized, and 10 of those are in the intensive care unit. It's worth pointing out that 49 of those 50 are there because of COVID, with 1 incidental positive, and all 10 of the ICU patients are there because of COVID. I think that's it in terms of the numbers and hospitalizations, but then sort of what do all these numbers mean? As you're probably aware, Placer County developed a set of triggers in its attestation to move forward into stage 2. And then after that, the state came up with this state county data monitoring program, or the monitoring list, as most people refer to it. And that is a set of 5 criteria, and any of those criteria can land a county on the monitoring list if the numbers are above the state's threshold for 3 days in a row. And then once you've been on the monitoring list for at least 3 days, there are now additional restrictions that apply to your county. So Placer County, beginning on July 9th, was added to the monitoring list because of increasing hospitalizations as well as decreased hospital capacity. So the state monitors the 3-day average, the 3-day average hospitalizations, and if they see a 10% increase over that 3-day average, then that puts a county on the monitoring list. So Placer County is on the monitoring list for that indicator, and today's number is a 25% increase in hospitalizations in that 3-day average, well above the 10%. And then the second item that Placer County is on the monitoring list for is our ICU bed availability. The threshold for that is 20%. And currently Placer County has 11.6% of its ICU beds available. The other indicator that we are not on the monitoring list for yet, and this one is quite confusing because there's multiple sets of data. You may, if you pay close attention to the monitoring list, know that the threshold for the case rate per 100,000 is 100. And I just told you that Placer County's case rate is 113 per 100,000, yet we are not on the monitoring list for that indicator. And that is because the California Department of Public Health calculates that metric differently than Placer County does. CDPH uses data that lags by 3 days, and then they also apply cases to different dates than we do. So Placer County uses the reporting date of the case, and CDPH uses the episode date, which tends to be earlier than the reporting date. So it's assigning our cases earlier in time. So we continue to watch that indicator, but right now CDPH is reporting our case rate at 85, and we have it at 113 approximately. So like I said, we'll continue to watch that one. So the implications of being on the monitoring list, as I said, Placer County has been on the monitoring list since July 9th. As of July 11th, we were on the monitoring list for 3 days, which prompted an order from the state public health officer. There's been a fair amount of confusion. That is not a local order by myself as a Placer County health officer. That's a state public health officer order. And that was for an initial set of rollbacks, closing bars, breweries, brew pubs, and pubs, unless they served sit-down dine-in meals and only outdoors, and then transitioning several other sectors to outdoor, including restaurants, wineries, and tasting rooms, movie theaters, family entertainment centers, zoos and museums, and card rooms. And then on Monday, July 13th, the world shifted again. I think just when people in Placer County were really learning about that first round of restrictions, then the state announced additional restrictions for businesses. They took what previously applied to counties on the monitoring list only, applied it statewide, and added additional restrictions for Placer and other counties on the list. And so that is where we find ourselves with additional restrictions to outdoor only for gyms and fitness facilities, places of worship, indoor protests, offices for non-critical infrastructure workers, personal care services like nail salons, tattoo parlors, and massages, hair salons and barbershops, and indoor malls. So that is the current state of reopening in Placer County in terms of the rollbacks. And, you know, in addition to these business rollbacks, and again, these came as part of a state public health officer order. So, you know, I can't speak to exactly why those businesses were selected, but, you know, in the order itself, it does discuss that these businesses are at increased risk. They're high risk because they encourage people to gather with non-household members. And in many cases, it's impossible to wear a face covering, such as in a bar or restaurant when you're eating or drinking. And so that mixing and lack of face coverings and difficulty with distancing were all some of the reasons why those particular sectors were selected by the state. So that's what we're asking businesses to do to help slow the spread. But there are many actions that we're asking residents to take, and you've heard a lot of these messages already. But it is, you know, staying 6 feet apart from others when you do go out in public, staying home as much as possible. We are still under a stay-at-home order. We're in stage 3 of that stay-at-home order, but we are not back to business as usual. So distancing, not gathering with people outside your household. And I know this one is very challenging, especially the longer we've been on these stay-at-home orders. But mixing across households, even if these are family members, extended family members, we have seen many gatherings come up as part of our case investigations and contact tracing. So barbecue, Father's Day, graduations, Mother's Day, birthday parties. We've seen some funerals and other memorial services. All those gatherings have been associated with cases in Placer County. So not gathering, wearing face coverings when you do go out in public, especially when you can't distance. As a reminder, on June 18th, the governor and state public health officer issued a statewide face covering mandate. And then I guess I said it already, staying home as much as possible. So those are the actions that all of us can take, whether we are a business owner or just a resident or a patron of these businesses, to help minimize the spread of coronavirus in Placer County. It really is a community effort that we're looking for. And, one of the things that, the California Department of Public Health has talked about as in terms of the timing of these rollbacks is one, cases were increasing, hospitalizations increasing, ICU beds decreasing across California, but also wanting to get cases down to a lower level, less community spread, so that it would be possible for schools to return to in-person classroom instruction this fall. So definitely a community goal there to get our kids back in school. So I think I'll stop there, and I'm happy to answer any questions that people have. I think, as Kevin explained, putting your questions into the chat function. So I will turn it back over to Kevin and Scott to MC.
All right, thank you, Dr. Aimee Sisson. And I do hope I'm pronouncing your last name correct.
It's Sisson, but you're close.
Sisson? Sisson, okay, close enough. Thank you. Just to go ahead and forward on a couple of questions, we do have a few flowing in. So we have one question is, can you address the relatively low level of testing in Placer County? The question references our position according to their knowledge compared to other counties within the state of California, and whether or not there are any active kind of programs going out there to try to maybe rectify that, if it is true. Thank you.
Yeah, testing numbers have increased significantly in Placer County over the last several months, as they have statewide. I do know when you look at the indicators on the, and I'm pulling it up on my other screen here, in terms of testing, average number of tests per day per 100,000. And again, these are lagged data, and it's a 7-day average. But we're at 143 tests. For example, Sacramento is at 155, but some other areas like San Francisco are at almost 300. So testing does vary across the state. We do have our 2 OptumServe testing sites, one up in Truckee and then one that originally was in Roseville that's now at the library in Rockland, and each of those sites can test 132 people a day. Obviously, that's not adequate. And right now we're experiencing significant challenges in getting people into those testing sites in a timely manner. So I actually went on yesterday to try to register, and the next appointment was 7 days away. And then we're also experiencing delays in getting those test results because Quest, which is the laboratory that OptumServe uses, is overwhelmed statewide. And so the average turnaround time for people getting tested at an OptumServe site is 150 hours, which is just over 6 days. So you wait 7 days to get your specimen collected and you wait 6 days to get your results. That's not acceptable. So unfortunately, the state is not offering any resources to expand OptumServe testing sites at this point. So the county has reached out to OptumServe to see if we can shoulder that financial burden to increase testing. Obviously, the OptumServe sites aren't the only places in Placer County to get tested. We encourage people to go to their regular healthcare provider first, but I know that our providers are also experiencing similar challenges with not having enough specimen collection appointments and also experiencing delays in reporting for laboratories. So testing is definitely a challenge right now. The state just released new priorities for testing to encourage testing of people in the hospital as well as people who have symptoms or people who have been exposed, but to try to make room for those people by testing fewer asymptomatic, unexposed people. But operationalizing that is very challenging, especially with a site like OptumServe, which does not discriminate. It's basically first come, first serve without prioritization. So we are working hard to get testing increased in the county, but there are a lot of challenges associated with that.
All right, thank you very much. Appreciate that thorough answer, and I can definitely attest the long test waiting time period. We had a brief concern about maybe some exposure, very small chance, but it did keep us on tenterhooks for about 8 days as we waited for results from somebody who had potentially exposed some of our members to COVID. Turned out it was negative, so good thing, but it did take a long time.
If I can just jump in, one of the things that we're trying to do in our messaging now is to get the word out to people about how to change their behavior while they're waiting either to get their specimen collected or to get their test results. So if you have symptoms and you're trying to make an appointment to get tested, you need to be isolating, which means you need to be staying home and not being in contact with anybody else until you get that test and get your test result. And then if you don't have symptoms, but you know you've been exposed to somebody who has or had COVID-19, then you also need to stay home even though you feel fine, because you could convert to positive anytime in the 14 days after that exposure. And 40% of people who are positive do not have symptoms. So you don't have a way of knowing unless you get tested. So while you're in that 14-day window after your exposure, you need to be staying home as well, even though you feel fine. So I think those messages, as much as you can help get the word out to your community members.
Spencer.
About
Join the meeting.
actions.
Gotcha. Yeah, and all very important. Just moving on to some other questions. Thank you for the information. We've got another one, and I think this is important and probably pretty close to a number of people here, but it has to do with schools. I understand there's already some information passing that maybe Gavin Newsom, the governor, is going to pass down something top level on the state. I haven't heard if that's happened. But do we have any information on the schools in Placer County and what their concerns are? Are there a lot of children who are currently testing positive? Is this a major issue? Are we thoroughly vetting everything in the school system for possibly opening up?
Yeah, so the governor is expected to make an announcement tomorrow on schools, so I think that will provide some guidance. So I encourage everyone to tune into that press conference at noon tomorrow. In terms of decision-making for Placer County schools reopening, that decision-making authority resides at the local level with each district. However, I do provide consultation and will make recommendations to districts in terms of reopening. And I've been in conversations yesterday and again today with our districts and with the Placer County Office of Education Superintendent. And so we, again, are awaiting that announcement from the governor before making any final decisions. But, you know, I will say that with Placer County being on the monitoring list, that indicates that
Join the meeting.
Disease is increasing, hospitalizations increasing, ICU beds less available. So I think those are all indicators that any return to in-person classroom instruction needs to be made very thoughtfully. In terms of cases in schools,
Join the meeting.
Schools are not in session right now, so we don't have that evidence. We can certainly look to other countries that have reopened schools. I think the most important lesson to be learned from the experience in other countries where they have been successful, the common factor is that the community disease rate was low before they reopened schools. So I think that is a further indicator, you know, sort of consistent with being on the monitoring list, that any decision to reopen schools when cases are increasing needs to be done very thoughtfully.
Absolutely. Children are both extremely important, but also I think in this particular disease, the concern is they're kind of super passers of the disease, less likely to have symptoms, and at least as far as I've read. I'm not an expert.
Yeah, I mean, I can say a little bit about that. And again, there's still a lot to be learned because coronavirus is new. Children definitely become infected with COVID-19, but it seems like they become infected less easily than adults, and that they are less likely to transmit infection. So that is good news. But students and children aren't the only ones in school. Adults are, and there is a lot more adult-to-adult transmission in school that we're concerned about. So I think we have to think not just about the students, but also the health and safety of their teachers, many of whom are vulnerable in a way that the children are not.
Absolutely. That's an excellent point. Thank you for the information. And please interrupt me at any point if you're ready to call it, because I do have quite a few messages popping in, so I know we have a lot of questions coming. So feel free, we're at your leisure in terms of time. But I'm going to go ahead and move on to some new questions. So we have another one, which is a concern, just a little bit more details about maybe some stats that aren't the most easily look up researchable in our area or in general. But what do you know about the average length of stay in ICUs once someone is admitted to that level of care in our area?
I do
or perhaps
not.
in general.
Yeah, I do not have data for Placer County on length of stay. Sorry, I'm trying to pull up. What I can say is there was a study that I read from China early in the epidemic that showed the average length of stay in the ICU for non-intubated patients was 9 days, and the average length of stay in the ICU for someone who was on a ventilator was 17 days. So that's some China data, but we haven't actually crunched those numbers for Placer County yet. But I would say anecdotally that our numbers are fairly similar to that.
Do you have numbers on how often the people actually heal out of the ICU and get downgraded to less severe care versus those that end up passing from the disease?
Well, all but 11 in Placer County have recovered, but I don't know what percentage that represents in terms of patients in the ICU. But I would say that nearly all of the 11 people who passed away from coronavirus in Placer County were in the ICU, although we had a few who were on comfort care, so they had been downgraded to from the ICU before they passed.
Okay, another question is, it has to do with the casinos. Are they currently still open? Would they even be within your purview in terms of regulations? I'm not sure they are, since they're
exactly. So casinos are operated by tribes, which are sovereign nations. So while there is state guidance from the California Department of Public Health and Cal OSHA related to casinos, the timeline for casino reopening is independent from the state reopening roadmap. And yeah, they do fall out of the jurisdiction of Placer County.
Gotcha. So we don't have too much information
Join the meeting.
Concerning that. Moving on. So there's some questions concerning places of worship and new regulations coming down. I've seen a couple of them coming through. I believe, and these probably originate with the state, and there's not much question in the county, but things like no longer any indoor worship, so the only ones they can have are outdoor. There was some question of whether or not it makes that much sense. In particular, like singing was banned indoors, but now it's still banned outdoors. And so do you have any information or address to that?
Yeah, so according to the July 13th state public health officer order, for counties that have been on the monitoring list for 3 days or more, so that includes Placer County, church services or places of worship can no longer operate indoors. So yes, all services must be moved outdoors. In terms of the singing was not allowed in indoor churches, or indoor places of worship, but the guidance, and I don't believe the guidance has been updated since the 13th order. So singing to the best of my knowledge, is allowed outdoors. It was only banned in indoor services. I will double check on that to make sure I'm not giving out incorrect information, but
Okay.
the guidance the last time I saw it was very specific, indoor no singing, but outdoor singing permitted.
Excellent. We'd appreciate if you could, validate that, because I did have a couple of questions that mentioned it. So that would be great. I'm just going to move along. So if you're looking that up, you can take a minute. Okay, so there's some questions about, do we have surge plans in place within our county if hospitalizations increase past known capacity? It looks like Sleep Train, I hadn't heard it had closed, but apparently it might be at this point. Are there any plans as that being a potential break point for us to move towards?
Yeah, so Sleep Train Arena its current status is a quote unquote warm close, and they've indicated that it will only reopen when there's at least 100 patients who need its services. As you'll recall, it opened previously, and there were very few patients who were ever in Sleep Train Arena. So it's an expensive facility to ramp up if you don't have patients. So that's the current guidance that we've received from CalEMSA. In terms of Placer County Hospital surge plans, each hospital has its own surge plan. They come in multiple stages. So initially, they'll surge a small amount, and then they can keep going. I don't have the numbers in front of me, but I can tell you that our hospitals can surge to basically double their capacity with a significant increase in ICU beds. So they're able to convert operating rooms to intensive care units, the recovery rooms or the post-anesthesia care unit or PACU to ICU rooms. They have a large number of extra ventilators, so they really do have a significant surge capacity, but I do not have those numbers in front of me.
Good. Well, it's good to know that we do actually have some surge capacity to make sure that if things go the wrong way, we'll be taken care of to that point. So moving along, we do have a question specifically about, it appears jury duty. Is jury duty going to continue as a necessary service, or is that something that's under consideration as being closed down as not necessary?
Yeah, the courts aren't under my purview, so I can't speak to what their plans are. But certainly I would think if our cases increase significantly more, that would be a consideration. But there are no immediate plans to stop jury duty.
Right. And I had heard originally when things came down, I think back in like March and April, a number of courts, which are under their own purview within their districts, jurisdictions, the courts themselves get to make that call, and a number of them did close, was my understanding, but a lot of them opened back up as really critical services moving forward. We have to have some means of dealing with law and order. We just have some general questions. I believe this one's a pretty easy one to answer. Is testing still only for select populations, or is it generally available for anyone who wants to request it?
Yeah, so it depends on where you're being tested. So our individual providers and health systems have their own criteria. And as I said, the California Department of Public Health this week came out with new tiers. So they've divided the population into 4 tiers. And the highest priority for testing is patients in the hospital, people who are part of an outbreak, or people who are part of a case investigation and contact tracing, and then it's symptomatic people. And then there's a couple tiers of asymptomatic people depending on their level of exposure, potentially in their workplace, or their level of vulnerability. So that's new guidance, and so I think our providers are still trying to figure out how to implement that. But as I said before, at our OptumServe sites, anyone can be tested whether they have symptoms or not. But certainly I would encourage people, especially given the current delays in testing, that if you aren't symptomatic and you don't have an exposure and you're just sort of curious, now's probably not the best time to get that test and save that resource for somebody who has symptoms or a known exposure.
Right. Moving along, can you explain the differences between the different types of tests available? So nasal swab, I'm guessing RNA tests versus antibody tests, that sort of thing.
Yeah, there's a few tests available. In the beginning, all we had was the nasopharyngeal and the oropharyngeal swab and PCR, and those are still available. That's kind of the standard is the nasopharyngeal swab, but we also have an anterior nares swab, which people can actually collect on themselves, so it helps save personal protective equipment. That's the front of the nose, and then there's a middle of the nose or mid-turbinate swab. So all of those are for the PCR testing, which is the best way to diagnose a current infection. There's also a new saliva test that has FDA emergency use authorization, and that can be collected at home and then sent in the mail. Although it does have to be collected under medical supervision, like by video chat. There's also now an antigen test. So the PCR detects the RNA of the SARS-CoV-2 virus or coronavirus. The antigen test detects the virus itself. And so there is an FDA or an emergency use authorization from the FDA for the antigen test. Again, that would detect current infection. Then we also have serology tests, which are the antibody tests, and that's a blood test. That is not useful for diagnosing a current infection. It can only indicate, well, it may indicate current infection or past infection, and there's no way really to differentiate. There are two different types of antibodies, but not all tests detect both of them. So really antibodies, the antibody or serology test, their best purpose is kind of on a population level to figure out the level of previous infection in a community. And as you're probably aware, Placer County is undertaking a seroprevalence study at the direction of the Board of Supervisors and in collaboration with Stanford University. And that study has not yet gotten underway, but it's still in the planning stages.
Okay, thank you for that. And moving on, we've got somebody who mentions that they live and reside in Placer, so that would be their address, but they got tested actually in Sacramento County, and they're curious how in those situations would their tests show up statistic-wise. Do they get counted in where they were tested? Do they get counted based off of their address? Oh, you've gotten muted.
Sorry, I muted for the dog barking.
There we
so
go.
the test results are reported by county of residence. So regardless of where the specimen is collected or which laboratory runs the test, if you're a Placer County resident, your test will be reported in Placer County, whether it's a negative or a positive. It will show up in our statistics, not in Sacramento County. Similarly, if people are Sacramento County residents and they get tested at a Placer County OptumServe site, those numbers do not show up in our test results, either as negative or positive. Those would only be reported in the county of residence.
Right, county of residence. So the address that you provide when you get tested.
Correct.
Let's see, and I apologize if I miss any of these. They're so dense now. As I scroll, some of them might get missed. Let's see.
I see a question about face shields, so I'll answer that one.
Go ahead. If you see one you want to grab, go for it.
Sure. So the question is, are face shields acceptable? And the answer is it depends. The CDPH guidance that was issued on June 18th with the state, basically the statewide face covering mandate, does indicate that people should wear a cloth face covering, but if they are not able, if they have a medical reason that precludes them from wearing a cloth face covering, they can wear a less restrictive alternative. And the example that's given is a face shield with a cloth drape on the lower edge. So essentially something over the face, but then a cloth that drapes down that would help to trap any droplets generated by that person when they talk, breathe, cough, or sneeze. So it can be acceptable in limited circumstances.
Yeah, I was going to say, how would that compare according to the best science you have, face shields versus cloth masks?
Yeah,
just my personal follow-up.
There is no data that I have seen that compares those two.
There's a question about specifically the type of tests, back to a testing question, that that the nation's leaders, for instance, I know high priority individuals had access to some very expensive tests that supposedly could give positive or negatives within a few minutes. Do you have any thoughts on those tests? Are they any concerns with those, or are those particularly good or just overly expensive?
Yeah, we actually, so some of our providers in Placer County have those tests, either at the hospital or in the outpatient clinic setting. One very common one is the Abbott ID Now technology. It can give results in about 10 to 15 minutes, but it can only run one person at a time. So you can only do like 4 tests an hour, and the reagents or the chemicals that are needed to run the tests are in limited supply. And then there's a second issue with that test, which is it can only be used for people who have symptoms because it has a high false negative rate. So if you get tested on that, and you should not be tested on that machine if you don't have symptoms. And if you do have symptoms and you test negative, it needs to be confirmed in a regular laboratory using traditional PCR. So it's also been associated with false positives as well. So it's not the most accurate technology, but it is very fast. We do have access to it, but it is limited. For example, I think one of our hospitals gets 50 a day, and that's the most that they can run on that machine.
Okay, I got another question specifically about what is the latest information available on how COVID is primarily transmitted. And of course, we all read various different news articles and everything kind of talking about that, how airborne is it? Is it droplets? Is it aerosols? Is it microdroplets? Do you have any latest thoughts as to how it gets transmitted, what its primary vector is?
Yeah, as I said before, coronavirus is still relatively new, and there's a lot that we still have to learn about it. There is new research coming out, and I know that the WHO has been updating its website to suggest that there may be more aerosol transmission than has previously been thought. But the thinking here amongst our government agencies, the Centers for Disease Control, is that droplet transmission is the primary route of spread, and that contact transmission plays a much smaller role. I think the language they use is not a driver of the epidemic, and they've similarly said that about aerosol transmission. We do know in hospital settings that there are certain procedures that are dubbed aerosol generating procedures, such as intubating somebody, certain other procedures. And so those should only be done with the highest levels of respiratory protection. But we don't think in general that aerosol transmission is a major component of coronavirus transmission. But like I said, the research is still ongoing there.
Definitely. Thank you for that. Here's a good question that's kind of comes to a number of the questions that have happened before as well as concerning RCONA. But what is the maximum number of people outside distanced, masked, following all guidelines? What is the maximum number of people we can have in a gathering, an organized event?
One. This is the state. The only gatherings that are permitted are at places of worship or protests. So places of worship include regular church services as well as weddings and funerals. And so the official language from the state is that those are the only gatherings that are permitted. I think I would be naive if I thought that everybody was following that. I know that they are not, because we see many cases associated with gatherings. So, you know, my messaging here is that the safest gathering is a virtual gathering, but the next safest gathering is outdoor with distancing, with everybody wearing face coverings and in a small group. So there isn't a number, because this, again, is not an officially sanctioned gathering. The official sanctioning of gatherings is one person, which is not a gathering at all.
And are there any limitations then on those two exceptions for protests and for worship? Do they have a number associated to those, or are those effectively unlimited as long as they are associated with the approved kind of theme?
Yeah, so because they are now only allowed outdoors, there is no limit. The limit is based on the capacity of the space itself. So the limit is based on how many people can fit in the space with at least 6 feet of distancing between non-household members.
Thank you. That's excellent information. I think a number of people and community members I know would actually appreciate that information. If you spot a question right now, I'm looking for, I think I've seen another, a couple of people repost them just to make sure they got heard. So I occasionally see some duplicates. Just some general question about, do we have any information on whether or not current transmissions are more likely to be communal or like gatherings? Are they workplace? Are they familial, right? They're actually from family members. Do we have any information on the most common spread vectors, I guess, in terms of person to person?
So I think the answer was yes, yes, and yes. We're seeing all of those in our case investigations. Let me just start by saying, you know, case investigation is challenging for coronavirus to determine where and how a particular individual was infected. Keep in mind that the exposure period is up to 14 days long. So that incubation is 2 to 14 days. So when somebody develops symptoms, they could have been infected any time in the last 2 weeks, and they could have been infected by somebody who was themselves showing no symptoms, because up to 40 to 45% of people infected with coronavirus have no symptoms. So that makes it very challenging for the case investigator on the phone to determine where this person was infected. For example, one of our recent cases, a healthcare worker who goes to casinos several days a week and is a regular participant at a gym. So would you call that a workplace exposure? Would you associate it with a casino? Would you associate it with a gym? We can't say with any certainty. If there were other cases in those facilities, that would help us. But if it's the first case, then we really can't determine what class or where that person was infected. So that's just sort of the overall caveat when it comes to case investigation. We have seen many cases associated with family transmission, especially in larger households where it's difficult for people to isolate. They don't necessarily have their own bedroom and own bathroom. We've also seen many clusters associated with workplaces. A lot of restaurants, food service, grocery stores, construction workers, and other outdoor workers is another area where we've seen a lot of cases. And then we've also seen a large number of cases associated with gatherings. I think, the list that I shared earlier in terms of barbecues, graduations, birthday parties, Mother's Day, Father's Day, all of those have played a role. One area where we haven't seen a lot of cases is associated with protests. I know a lot of people have suggested that many of Placer County's cases and other cases are associated with protests, but having reviewed our cases, and all cases are asked about gatherings, we've only seen 3 to date that are associated with protests, and 2 of those were in law enforcement officers working those protests.
Wow, that's actually really interesting information, because I definitely see a lot of that going back and forth in arguments on social media if you spend too much time there. Let's see. Question towards reinfection. What is the current latest information concerning reinfectability of those who have already recovered?
Yeah, this is another area of emerging, not emerging data, where we need more data. There have been some reports of reinfection, and we don't yet know, for example, when people recover, how long they will be immune, if they even are immune. So I think there's a lot to be learned in terms of reinfection. I don't think reinfection is a major issue, but it's also very early on, and so there hasn't been very much time that's passed for us to have a large enough sample of people who have recovered, who may begin to have waning antibodies and waning immunity. So no great answers when it comes to reinfection, and it would be very nice to know after you've recovered how long you would be considered immune, and we just don't know that yet.
There's a couple of questions, similar themes. And I think you may have already addressed this, so if so, feel free to answer shortly. But about reopening schools, and whether or not one of the main concerns is also spreading that back towards older members of families when children go in, and daycare, everything along those lines. You already mentioned, I think, staff and faculty as a concern.
Yeah, I mean, it is definitely a concern. There is some data that suggests that children are not great spreaders of coronavirus, and that is reassuring. But if you have enough kids, even if they aren't great spreaders, eventually disease will be spread. So that is a concern, that children would bring disease back to more vulnerable members of their household.
Okay, here's a question specifically about whether or not there's an active contact tracing program. Does the state have it? Is it CDC? Or perhaps we're so busy, everyone's inundated, there's not a lot of contact tracing anymore?
Oh no, we are extensively contact tracing. We have a team of close to 100 employees in Placer County, between full-time and part-time. We've been actively training and onboarding to a new system called CalConnect, which will hopefully streamline our contact tracing process. But every case is contacted by somebody from the county to discuss their symptoms, where they think they became infected, and then to ask them who they've been in contact with since the 2 days before they developed symptoms, or 2 days before their specimen was collected, if they have no symptoms. And then all of those people are contacted and asked whether they have symptoms, and we also work to get them tested twice. Anyone who's a close contact of a case is asked to quarantine at home for 14 days and then get tested once on day 5 to 7 after their exposure, and again on day 12 to 14. So we are very actively contacting every case and following up on every contact. But I will say it is challenging and has diminishing returns the later public health learns about a case. And so with the delays in getting people tested and then getting those test results, it significantly reduces the effectiveness of our contact tracing efforts.
Excellent. I think I'm getting to the end of our list of questions. Does anyone else have anything else they want to go ahead and bring up? If I missed anything, I apologize. Again, there was quite a bit there, and I may have scrolled over, but I think I got back to most of them. Did you spot any questions
Well, I just see a few. I see some questions about face coverings and enforcement, and so I'll just say that, you know, as the health officer and public health director, public health's role is really an education role. We have Placer County has its Let's Get Covered campaign, and we are really trying to positively promote the use of face coverings. There is, of course, the state mandate for face coverings that was issued on June 18th. And Placer County Public Health's role is really to provide education that is indeed a mandate, that people need to wear face coverings when they are basically out and about in the community. And so that is our role. So I really can't, public health does not have an enforcement arm.
Okay. Somebody helped bring my attention to another question. What is the criteria used to determine when someone is considered cured or recovered from COVID?
Yeah, that's a great question, and an opportunity for me to clarify an area where there's a lot of confusion among our employers, which is also helping, is making it more difficult to get people tested. So somebody is considered cleared, or basically discontinuation of isolation is the official public health term. So they can go back to work, they can go back to their normal life, based not on a negative test, but based on the CDC's time and symptom-based criteria. So if somebody tested positive and that person had symptoms, they would be considered cleared from coronavirus or recovered when three things have to happen. One, there have to have been at least 10 days that have passed since their symptoms started. Two, at least 72 hours without a fever, without taking any anti-fever medications like Tylenol or ibuprofen. And third, their symptoms need to be improving. So if you meet all three of those criteria, you are cleared. You do not need a second negative test. Or I'm sorry, you do not need a negative test. You can go back without being retested. If you never had symptoms in the first place, then you are considered cleared 10 days after your positive specimen was collected. So that may not be 10 days after you got your test result, but 10 days from when you were swabbed is when you're cleared if you never had symptoms. So those are the time and symptom-based clearance criteria. We don't have enough resources, nor is it a good use of those resources to require a negative test. We see that many positive cases will continue to test positive for a month, sometimes 2 months, but that does not mean that they're still infectious. It just means that there's some residual RNA that is showing up, but it doesn't indicate live virus. And the CDC uses the 10-day criterion because there was a study in Germany that showed that after 9 days, when they grew the virus in culture, that essentially there was no more live virus after 9 days. So that's where 10 days comes from.
Okay. I do have a couple more questions, and I'm seeing some more messages too. So I think people are either questioning or maybe resubmitting if I missed one. But I have one. Do we know if how Placer County compares to other counties and states in terms of all of our regulations, testing processes? Are we in line with how everybody else is doing things, or are we a little bit unique? Are we paving our own path?
I think in terms of testing, Placer County is very similar to other counties in terms of having these public free testing sites through OptumServe. I know some other counties have Verily, and then offering testing through various through people's regular primary care providers or through urgent care, and then obviously testing at hospitals. So those are all, I think that's pretty consistent statewide. I would say our testing is consistent with the rest of the state, although our numbers are a little bit low, and we're working to get those up.
And what about the kind of lockdown regulations? Are those also in line with what everybody else in the state is experiencing, and how about other states?
Yeah, I mean, I can really only speak to California. It's hard enough to keep track of much beyond Placer County. I think we are on the monitoring list, so we are more impacted here in Placer County than some other counties, but the majority of counties and the majority of people in California are in counties that are on the monitoring list. So I think that makes us more similar than different to other counties in the state. I think early on in the reopening, we were the fourth county in the state to get a variance to move more deeply into stage 2, which allowed us to open our restaurants for in-person dining, open our malls for indoor shopping and indoor retail. But we never moved faster than the state allowed us to. So we're always under the statewide stay-at-home order, and now under the state public health officer order. So Placer County doesn't have any local public health orders that are more restrictive than the state.
Gotcha. Okay, so I had gone back into some older stuff, and I see some new questions popping in, but I'm going to get one more older one. And I'm going to interpret this question slightly, but they were asking about whether or not there's any help required for local contact tracing. I'm going to assume that maybe this is concerns as to whether or not there's a volunteer program. Contact tracing can be done through phones, non-contact. Maybe there's something where individuals in the community could help out.
Yeah, the vast majority of our contact tracers are extra help staff who have been recently hired by the county and then trained both initially by the county and then by the state and then again by the county. So that's how we have ramped up. At this point, we don't have a need for additional volunteers, but we've closed the job posting, but we may, depending on where things go with disease spread and whether we need to test, or, sorry, we're getting some feedback and then.
Join the meeting.
Oh, that's what that was. I apologize.
Okay. No, that's okay.
Somebody's name being announced.
I was having a hard time keeping my thoughts straight when I was hearing myself from the past. I think I was saying we closed the job posting for contact tracers, but if we need to ramp up again, should we see a surge in cases, we would reopen that and be looking to train additional contact tracers. One great thing about contact tracing is it is done over the phone, and so people can do it while working from home after an initial period in the office, just to make sure that the quality assurance is there. So that's definitely a good thing, because we want to minimize. We don't want to be tracing cases in our own contact tracers.
Exactly.
And
there's some mention.
I have time for probably one or two more questions.
Join the meeting.
Okay. I'm looking through people who have mentioned that I may have missed them. Repost them so that they're at the bottom, so that they're easy, because it's going to be too hard for me to dig back through to locate your previous message. I'm going to move in one more, hopefully quick, with contact tracing. Apple, Google, and I believe a number of other application vendors have started doing contact tracing apps. Do we do any helping with that? Do we coordinate with them? Is that something we can use to help?
Yeah, those are opt-in for people on their phones, and as far as I know, those do not link with the state's contact tracing technology platform, which is called CalConnect, that Placer County is in the process of onboarding with. So I don't know of a way to use that, for that information to feed into our contact tracing. But that's, I think that Accenture and Salesforce designed the platform, and so maybe that's a function that they're trying to build in moving forward. But right now, there is not that connectivity to feed that data into CalConnect.
Gotcha. Thank you very much. And I see a lot of when they heard you're going to be going away, a lot of thank you for all of your hard work, a lot of appreciation for everything you're doing. And I'm just trying to see if there's one last question we can get. Something about air travel. What about essential, non-essential? What are current regulations that you know of concerning air travel and movement?
Yeah, I don't think that there's any restriction in terms, well, there are international restrictions, and then as someone coming from California, because our case rates are high right now, there are limitations on where you can go without having to be subjected to a 14-day quarantine upon your arrival. I would discourage anybody from traveling really anywhere right now. We are still under a stay-at-home order. While it is stage 3, the best way to protect yourself is to stay home as much as possible. So I would say that non-essential travel is discouraged. The state does have language on its website around travel, and it basically encourages people to be thoughtful about the disease rates where they're coming from, the disease rates where they're planning to go to, and making sure that they're protecting themselves as well as any more vulnerable family members. But I would say staying close to home or actually at home is the safest place to be right now.
Gotcha. Thank you. You briefly mentioned and explained that enforcement is not in the purview. You're about
Join
education.
the meeting.
Several people were just kind of asking who would be the agency who, if there was an enforcement group, would they communicate with or bring any address concerns to?
Yeah, it really depends on where you are in Placer County. So if you're in city limits, then you would work with your city government. If you're in an unincorporated part of the county, then that does fall on Placer County, and then it also depends on the type of business that you're concerned about. So restaurants fall under Health and Human Services, under Environmental Health, but most other businesses are not regulated by the county Environmental Health, and so those can, depending, they can go to code enforcement or they might be referred to law enforcement. So it really does depend on location and business type.
All right. Well, thank you very much, and thank you for your time. Really appreciate it. You mentioned previously you're about ready to take off. So do you have any parting words, or you go ahead and are you good to go?
I think I'm good to go. Just thank you for the opportunity, and just want to reiterate those messages about staying home as much as possible, washing your hands, staying 6 feet away from others, not gathering with non-household members, and wearing your face covering.
Thank you very much. Good information for all of us to live by, even in times when there are no COVID. Good hygiene never hurt anybody. Thank you so much. And again, lots of positive and thanks from everybody in the chat.
Thank you.
Thank you very much. Appreciate it. All right. So to anybody who's here just to listen to her, we do appreciate you guys having come to our meeting. Obviously, we're very much glad that you were here and that we were able to assist in getting that information out to you. And I do apologize if I missed any of your questions. I did do my best to try to find out all of them and try to get them addressed as best as we could. A little bit limited, so I hope you understand. COVID makes things a little bit strange, but I am glad that everyone was able to come out and we were able to help you out. We'll be moving on to the rest of our agenda, so you are obviously welcome to stick around if you would like, but you are also under no obligation to do so because there will be a number of specifically RCONA related conversations having to do with our fundraising as well as just in general housekeeping information. Would love to see you guys come back again. If you are interested in our future meetings, we always try to have a guest speaker come and actually give a little bit of information from the county, from the city, perhaps at some point from the state, but just people to come and actually contribute a little bit more and allow to facilitate information that comes from us, the grassroots of Roseville, and percolate that up to the people who are in power and trying to help actually rule and govern our area. So that is one of our core goals here. So appreciate you guys all turning out.